Obesity has been defined by the World Health Organization or WHO as a disease. So the WHO has said that BMI or body mass index can be used as a way to measure obesity. So BMI क्या होता है? It is basically a ratio of the height and weight. Anybody with a BMI more than 30 is classified based upon this definition as being obese. Essentially what this means is that excessive deposition of body fat that leads to health problems or makes somebody at a significantly higher risk of having obesity associated health problems. BMI is just one of the measures. It's an easy way. It can be BMI calculators are readily available. Somebody can even download it on their phone to help give them an idea and measure the obesity. Obesity can cause problem from head to toe. We see that obesity is significantly associated with metabolic problems such as diabetes, high blood pressure, high cholesterol, and all of these things together make somebody at a much higher risk of having heart attack or a stroke. Because somebody who suffers from diabetes, metabolic problems, we may be about 6 to 10 times increased risk of having a heart attack. The second type of problems that come with obesity are like fatty liver disease, joint problems, somebody early onset arthritis कि कम एज में ही पैरों में दर्द, जोड़ों में दर्द शुरू हो गया. That then becomes a cycle, एक vicious cycle कि अच्छा मूवमेंट कम हो गया, मोबिलिटी कम हो गई, साइमल्टेनियसली एक्सरसाइज की कैपेसिटी कम हो जाती है और उससे फिर वज़न बढ़ना शुरू हो जाता है. एक बारी वज़न बढ़ना शुरू होता है तो कई बारी डिप्रेशन, मेंटल हेल्थ प्रॉब्लम्स वो भी साथ साथ ओबेसिटी के आनी शुरू हो जाती हैं. सो इट बिकम्स अ विशियस साइकिल इन इटसेल्फ, लीडिंग टू लो सेल्फ एस्टीम, depression, and moreover a poor quality of life, or impaired quality of life overall. It's seen that obesity is has an increased risk of several cancers. In men, prostate cancer, thyroid cancer, colorectal cancer; in ladies, breast, uterus. All these are seen at a much higher level in people suffering from obesity. Obesity needs to be treated like a disease. It needs a thorough evaluation and assessment. First of all, we need to see, it is very easy for somebody to say कि अच्छा obese है तो इनकी diet ठीक नहीं होगी, खाना गड़बड़ होएगा. But it usually doesn't work like that, because obesity is an imbalance between calorie intake and calorie metabolism, the calorie burning. Somebody's diet may be fine, but they may not be burning the calories appropriately. They may not, their body may have a slow metabolism. They may be on medication that can cause weight gain. They may have a hormonal problem. Thyroid problems, PCOS is associated with obesity. Several problems are there that somebody may have a genetic predisposition. In families, obesity can run in families. So when somebody comes to us for obesity treatment, we have to first analyze the causes of obesity. Of course, everybody will need a thorough diet evaluation, because that is one of the common 30-40% patients may have a very wrong or impaired diet that can be corrected to quite an extent. But like I said, it's one of the factors, and we need to assess all the factors. If it is obesity beyond a point, say BMI more than 37, then apart from all the lifestyle measures that need to be done, right diet, exercise, maybe even medication, patients may even need to be considered for bariatric surgery to help them lose that excess weight, to kickstart that weight loss journey. Bariatric surgery has specific criteria that we follow. These are given by the National Institute of Health, and there are guidelines followed all over the world. In the Asian patients, the BMI body mass index is followed, BMI more than 37 or BMI more than 32 with obesity associated medical problems. There may be several problems such as diabetes, cholesterol, joint problems, sleep apnea, like causing excessive snoring, breathing problems, heart condition. So any of these obesity associated problems may be present, especially if somebody's already tried losing weight with diet and exercise and they are not able to, and they're having metabolic problems at a younger age. Then we need to start thinking of bariatric surgery sooner than later, before the vicious cycle starts. There is a reason for this, because when we are looking, saying BMI more than 37, this is somebody, say, who's 5 feet 5 inches in height. Their weight should be 60-65, but they are weighing 80-90 kilogram. So it's very difficult for somebody who's about 30 kg excess weight to lose it and maintain it with the help of just diet and exercise. That is where bariatric surgery comes of help. That yes, it will help you reduce the portion size, improve the metabolism, improve that cycle of that imbalance of calorie intake versus calorie metabolism. That is where bariatric surgery would come in, and but the healthy diet and exercise still needs to be followed, so somebody can get the best results from bariatric surgery throughout as an ongoing process. Surgery is very safe in today's day and age. It is very standardized. The complication rates of surgery are very low, less than 1%. This is less than some of the other common general GI surgeries we do, such as gallbladder, hernia surgeries. So yes, it is not so much about the complications with bariatric surgery. The main issue with bariatric surgery is the motivation to understand what surgery involves, what is the life, the diet that needs to be followed, the supplements to be taken, the exercise that needs to be done, so that somebody can always continue to benefit from the surgery. So I would not call it a restrictive lifestyle. I would hope and that all my patients post bariatric surgery have a much enhanced life with a much better quality of life. Yes, the restriction that should be followed is that you're not eating out too often. Once a week is okay, but if you're eating out every day or more than once a week, then you will not get the maximum benefit from surgery. You may put on some of the weight that you've lost with the help of surgery also, because weight always tends to come back. It's a lifelong struggle with weight. So somebody's obese, then they have to put in that effort throughout. But after the surgery, we expect patients that within 2 weeks they should be exercising, whatever form of exercise they can do, whether it is brisk walk, whether it's joining a gym, treadmill, whatever exercise, sports, some form of exercise, following a healthy diet for the most part, avoiding smoking, generally all the good healthy life measures. So yeah, I would not call it restricting. These are restrictions that you should follow regardless whether you had bariatric surgery or not. After the bariatric surgery, we see that 80% patients are able to maintain weight loss. For their studies 15 to 20 years after the surgery now, that most of the patients, about 80%, will maintain most of the weight loss. Say supposing they lost 40 kg, they may put back 5-7 kg, but they should be able to have most of that weight should be off even 10-15 years down the line. 20% patients may put on some of the weight or regain most of the weight, and these are those patients are typically the ones who are taking a lot of snacks or not following a healthy diet. Surgery is not a substitute for following a healthy diet or doing some basic maintenance level of exercise. You always need to follow the diet part and exercise, so you come in that 80% patients who maintain the weight loss, and not in the 20% who tend to put back some or most of the weight. bariatric surgery, a lot of the patients get it done for weight, but actually I would say 40-50% patients get it done for the weight associated problems such as uncontrolled diabetes, high blood pressure, having a very high risk of family history of cancers, PCOS, having joint problems. They've gone to an orthopedic doctor and they're candidates for a knee replacement at an early age, but they need to reduce weight, otherwise the knee replacement will not be quite as effective. So all the apart from the weight loss, there are extensive benefits: treating metabolic problems, reducing cancer risk, improving fertility, treating fatty liver disease, and overall I would expect patients to lead a much happier, healthier, more active life, where you are exercising, you're eating right, and you're generally have a more positive outlook about yourself.